Hey guys, tonight we begin with something that makes modern emergency rooms look like five-star resorts: frontier medicine, the sawbones, the snake oil, the surgery performed on saloon tables with whiskey as anesthesia and a leather belt to bite down on. You've seen the westerns, the kindly doc with his black bag rushing to save the wounded hero with skill and compassion. Sounds noble, right? Wrong. The reality was rusty instruments, zero understanding of germs, and a survival rate that made Russian roulette look like reasonable odds. Most frontier doctors learned their trade by watching other men fail, and their patients paid the price in blood, screams, and shallow graves. So before you get comfortable, take a moment to like the video and subscribe, but only if this kind of journey genuinely speaks to you. So you want to be a frontier doctor? Too bad. You don't want this. No one wants this. It's something that happens to you, like dysentery or getting kicked by a mule. Maybe you were a barber back east who got tired of cutting hair and figured cutting into flesh couldn't be much harder. Maybe you read a medical book once, one book, possibly outdated by 2 decades, and decided that qualified you to remove bullets from screaming men. Maybe you just lied. Because out here, in the territories where law is thin and desperation is thick, no one checks credentials. There are no credentials. Medical school? That's a luxury for fancy city folk. If you're lucky, you apprenticed under another doctor for a year or 2, watching him bleed patients and prescribe mercury for everything, from syphilis to sadness. If you're unlucky, which is more common, you learned medicine the way most frontier skills are learned, by catastrophic trial and error. Your first patient might have been yourself, digging a splinter out with a dirty knife. Your second patient might have been a neighbour's horse. By the third, you were calling yourself Doc and charging $2 a visit. The competition isn't exactly fierce. In a town of 500 people scattered across mining claims and cattle ranches, you might be the only person within 80 miles who owns a scalpel. That makes you essential, regardless of whether you know the difference between a kidney and a kneecap. Your training manual is a dog-eared copy of Guns Domestic Medicine, a book written for lay people that advises bloodletting for fevers and tobacco smoke enemas for drowning victims. Yes, really, you're supposed to blow smoke up their rear ends. This is considered advanced medical knowledge. Your medical bag contains exactly what you could afford and carry: a set of surgical tools that haven't been sharpened since the Civil War, a bottle of laudanum, some calomel powder that's basically mercury dressed up for a party, and whiskey. Lots of whiskey. The whiskey isn't for sterilizing instruments. You don't know what sterilization is. The whiskey is for the patients, and for you, mostly for you, because you're about to perform surgery in a room lit by candles on a patient held down by ranch hands, using techniques you half remember from watching an army surgeon work during the war. And that surgeon's patients mostly died too. Congratulations. You're the closest thing to modern medicine for 100 miles. Don't celebrate yet. Your first emergency is already riding toward town, bleeding from a gunshot wound, and everyone's looking at you like you have answers. You don't, but you'll pretend you do, because out here, confidence is half the cure, and the other half is luck. Let's talk about your office, because calling it an office is generous. It's a room. Sometimes it's a room in your house. Sometimes it's a room above the general store, sandwiched between barrels of flour and whatever's rotting in the corner. If you're in a boom town, it might be a tent, canvas walls flapping in the wind while you try to set a broken arm. The smell hits you before anything else. A complex bouquet of old blood, unwashed bodies, whiskey fumes, and something medicinal that might be ether or might be turpentine. You stopped being able to tell the difference months ago. Your examination table is whatever flat surface you could find. In better setups, it's an actual wooden table, scarred and stained from previous procedures, with leather straps nailed to the sides for when patients need to be restrained. In worse setups, and there are always worse setups, it's a door laid across 2 barrels. You've performed surgery on dining tables, saloon, counters, and once on a church pew that the preacher wasn't happy about. But what was he going to do? The man was bleeding out, and Jesus would understand. Lighting is a problem you never solve. Candles and oil lamps cast flickering shadows across everything, making it nearly impossible to see what you're doing inside a wound. On sunny days, you drag patients near the window and pray the clouds don't roll in mid-procedure. At night, you work by the light of whatever the family brought with them, squinting at anatomy you can barely see, hoping the wet thing you're touching is what you think it is. Sometimes you bring a magnifying glass. It helps. Sometimes your instruments hang on the wall or sit in a leather case that's developed its own ecosystem of mysterious stains. Scalpels, bone saws, forceps, probes, bullet extractors, all of them used on patient after patient without cleaning beyond a quick wipe on your apron. The concept of germs won't reach the frontier for years, and when it does, you'll probably dismiss it as city nonsense. Right now, the brown residue caked on your saw is just evidence of hard work. You're proud of that residue. It means you're experienced. There's a cabinet in the corner with your medicines, bottles of laudanum, jars of calomel, some patent remedies you bought from a travelling salesman who swore they cured everything, and a collection of herbs you gathered because someone's grandmother said they worked. Your most reliable treatment is still whiskey. It won't cure anything, but it makes patients care less about dying, and honestly, some nights that's the best you can offer. Your patients don't come to you for checkups or wellness visits. They come because something has gone terribly, catastrophically wrong, and they have no other options. The frontier doesn't produce hypochondriacs. It produces people who ignore injuries until those injuries threaten to kill them. By the time they reach your door, they've already tried home remedies, prayer, and whiskey. You're the last resort before the undertaker. Gunshot wounds are your bread and butter, if bread came soaked in blood, and butter screamed when you touched it. Cowboys, miners, outlaws, lawmen, everyone out here seems determined to shoot everyone else. The bullets aren't clean surgical projectiles, they're lead balls that shatter bone, drag clothing and dirt into wounds, and lodge in places your probes can't reach. You dig around in mangled flesh while the patient writhes against the hands holding him down, and sometimes you find the bullet. Sometimes you don't. Sometimes you find it but can't remove it without killing the patient. And sometimes, more often than you'd like, you find that the bullet has already done damage no amount of digging can fix. But guns aren't your biggest enemy. Accidents are. Mining claims produce men with crushed limbs, fractured skulls, and fingers that used to be attached but aren't anymore. Cattle drives deliver cowboys trampled by stampedes, gored by horns, or thrown from horses onto rocks. Logging camps send you men split open by axes that slipped. Every dangerous profession in the territory eventually deposits its broken workers at your door, and the frontier has nothing but dangerous professions. Then there's disease, the silent partner in your practice. Cholera sweeps through settlements like divine judgment, killing faster than you can reach patients. Typhoid follows wherever water runs foul, which is everywhere. Smallpox still stalks the territories, leaving survivors scarred and dead counting as lucky. Dysentery, pneumonia, consumption. You see them all, and your treatments do almost nothing. You bleed patients who are already weak. You dose them with mercury that poisons their organs. You tell families to pray, because prayer is at least as effective as anything in your cabinet. The children are the hardest. They come in with fevers you can't break, with infections from tiny cuts that spread until their little bodies surrender. Mothers look at you like you can perform miracles and you can't. You've never been able to. You do what you can and watch them die anyway. Then tell yourself it wasn't your fault. It wasn't. But knowing that doesn't help you sleep. So you've decided the patient needs surgery. Congratulations on making the most terrifying decision either of you will face today. Frontier surgery isn't a medical procedure. It's a controlled disaster that you're hoping will end slightly better than it started. There's no anesthesiologist adjusting gas levels. There's no sterile operating theatre. There's you, a saw, and a patient who's about to experience pain that would make torture seem recreational. Your anesthesia options are limited and mostly inadequate. Whiskey is standard, you pour it down the patient's throat until they're drunk enough to be manageable, but not so drunk their heart stops. Laudanum helps if you have it, dulling the edges of agony into something merely unbearable. Chloroform and ether exist, but they're expensive, volatile, and you've heard stories of patients dying from overdoses because no one knows the right amount. So you use what you have and hope it's enough. It's never enough. The patient screams when you make the first cut. They scream when you probe the wound. They scream when you saw through bone, a sound you'll hear in your nightmares for the rest of your life. Not the saw itself, but the screaming over it. Strong men writhe so violently that the people holding them down struggle to maintain their grip. Some patients pass out from pain, which is actually a mercy. Some don't. You work as fast as you can, because speed is the only kindness you can offer. Amputation is the procedure you perform most and hate the most. A gangrenous leg, a crushed arm, a hand so mangled by machinery that saving it would only save an infection. You've gotten fast at it. Tourniquet, circular cut through flesh, saw through bone, tie off the blood vessels, close the stump. Under 10 minutes, if everything goes well. But everything doesn't go well. The saw catches on bone. The patient lurches at the wrong moment. The blood vessels retract and you can't find them to tie them off. And even when the surgery succeeds, the infection comes later. It almost always comes later. You've seen surgeons back east use carbolic acid spray and talk about something called antiseptic technique. You've heard Lister's name mentioned like a prophet's. But out here, those ideas seem like theory from another world. You don't have carbolic acid. You don't have clean water half the time. You have your hands, your instruments, and the knowledge that however bad your surgery is, the patient's only alternative was dying slower and worse without you. That has to be enough. You tell yourself it's enough. You don't know what germs are. You can't see them. No one has explained them to you in a way that makes sense, but you know something kills your patients after you've done everything right, and you have no idea how to stop it. Infection is your constant companion, the shadow that follows every procedure, the uninvited guest at every recovery. A surgery can be flawless, and the patient can still die rotting from the inside out. The first sign is usually the smell. 3 days after surgery, you unwrap the bandages and it hits you. Sweet, rotten, unmistakable. The wound that looked clean when you closed it is now weeping yellowish pus. The flesh around the edges is angry red, hot to the touch, spreading darkness beneath the skin like ink in water. This is wound fever. This is gangrene beginning its march. And once it starts, you have almost no way to stop it. Your treatments are desperate guesses disguised as medicine. You apply poultices made from bread and milk, hoping to draw out the poison. You lance the wound to let the pus drain, releasing a smell that clears the room. You prescribe calomel, dosing the patient with mercury that turns their gums black, and their breath foul while doing nothing to stop the infection. You might try maggots if you've heard the old battlefield trick. They eat dead tissue, and sometimes clean a wound better than anything else. But mostly, you watch and wait and pray. Blood poisoning is the worst. It starts local and goes everywhere. The patient develops a fever that climbs and climbs. Red streaks spread from the wound, up the limb like rivers on a map. Their pulse races. They become delirious, talking to people who aren't there, fighting phantoms in their sheets. You know what's coming. You've seen it too many times. The body is being overwhelmed by something invisible that you can't fight, can't cut out, can't burn away. All you can do is make them comfortable and tell the family to say goodbye. Years from now, someone will explain that your unwashed hands and unsterilized instruments were carrying millions of tiny killers into every wound you touched. That the pus you saw was your body's desperate battle against invaders you introduced. That simple soap and boiled water could have saved half the patients you lost, but you don't know that now. You won't know it for years, and even when you hear about it, You might not believe it, because how can something you can't see be more dangerous than a bullet? Your medical cabinet is a museum of hope and poison, and honestly, you can't always tell which is which. Everything in there is meant to cure something, but half of it will kill you faster than the disease if you dose it wrong. The other half won't do anything at all except separate patients from there. Money. You dispense these remedies with confidence you don't feel, because doubt isn't something a frontier doctor can afford to show. Calomel is your workhorse, a white powder made of mercury chloride that you prescribe for practically everything. Fever? Calomel. Constipation? Calomel. Vague feeling of unwellness? Calomel. It makes patients salivate profusely, which you interpret as the body purging itself of toxins. It also makes their teeth fall out, their gums blacken, their kidneys fail, and their bones deteriorate. But those side effects take time to develop, and most of your patients either recover or die before you see the long-term damage. Laudanum is the mercy you can actually offer. It's opium dissolved in alcohol, and it does exactly what you need it to do. It makes pain go away. Patients drink it for everything from toothaches to tuberculosis, and for a few hours, they don't care about dying. The problem is addiction, though you don't call it that. You call it dependence or habit, and you watch patients who started on laudanum for an injury beg for more and more until they're hollow-eyed shadows, spending every penny on the bottle. You prescribe it anyway. What else can you do? The pain is real. Patent medicines line one whole shelf, bottles and jars with labels promising cures for everything from female complaints to consumption. Hamlin's Wizard Oil, Hostetter's Bitters, Kickapoo Indian Sagwa. You don't know what's in most of them. Alcohol usually, sometimes opium, occasionally cocaine, frequently nothing but flavoured water. But patients ask for them by name because they saw advertisements in newspapers. And if believing in a miracle helps them feel better, who are you to argue? Placebos have their place, especially when you've got nothing else. The honest truth you'll never tell anyone: bloodletting, purging, blistering, and dosing with mercury, the 4 pillars of heroic medicine that you learn from textbooks, probably kill more patients than they save. But they're what you were taught. They're what patients expect. And when you do nothing, when you admit you have no cure and simply let the disease run its course, they accuse you of negligence. So you bleed them and purge them and poison them with mercury, because doing something feels more like medicine than doing nothing, even when nothing would be kinder. Childbirth isn't usually your territory. Most women on the frontier deliver with midwives, neighbour women, or alone in their cabins biting down on leather while hoping for the best. You get called when things go wrong, which means by the time you arrive, things have gone very, very wrong. The mother has been labouring for days, the baby won't come, blood is soaking through everything, and everyone is looking at you like you can fix this, when the truth is you're as scared as they are. Your obstetric tools are medieval horrors dressed in medical legitimacy. Forceps that look like salad servers designed by a blacksmith. Hooks for repositioning babies that don't bear thinking about. A craniotome for when the baby is already dead and needs to be removed in pieces to save the mother. You've used all of them. You've had to, and you've never gotten used to any of them. The decision that haunts you most is when you can only save one. The baby is stuck. The mother is failing. You can try to save the child and risk losing the mother, or sacrifice the child to save her life. There's no anesthesia for these choices, no ethics board to consult. Just you, exhausted and terrified, making a decision that will define someone's life or death while a family waits outside, praying to a god who seems to have stepped out of the room. Puerperal fever kills the ones you save. Childbed fever, they call it, a bacterial infection that you introduce with your own unwashed hands after examining the mother. She survives the delivery, holds her baby, seems to be recovering. Then the fever starts, the chills, the racing pulse. Within days she's dead, and the baby you worked so hard to deliver is motherless. You don't know you caused it. You won't know for years. You just know that birth which should be the beginning of life, so often becomes the end of it instead. Some nights, after a difficult delivery, you sit alone and drink and wonder if any of this is worth it. The mothers who died, the babies who didn't breathe, the ones you saved who won't remember your face because they were too young or too unconscious or too far gone in fever. You keep delivering babies because someone has to, because the alternative is women dying alone in cabins, with no one to help at all. It's not much comfort, but it's the only comfort you've got. Someone knocks on your door at midnight, face swollen like a melon, jaw locked with pain so intense they can't speak. Congratulations, you're also the dentist now. There's no separate professional for teeth on the frontier. There's just you, your forceps, and a molar that needs to come out before the infection spreads to the brain and kills someone over a rotten tooth. Extraction is brutal. The patient sits in a chair, sometimes your examination chair, sometimes a kitchen chair brought from their home. You grip the tooth with forceps and twist, rock, pull, working it loose from the bone while the patient screams and grabs at anything they can reach. Sometimes teeth come out cleanly, sometimes they shatter, and you spend 20 minutes digging fragments out of bleeding gums. Sometimes they're so decayed that they crumble the moment you apply pressure, and you're fishing pieces out of the socket for an hour. Anesthesia for dental work is whiskey straight. You tell them to drink until they're wobbling, then drink some more. Some patients bring their own bottles, some bring friends to hold them down. One man brought a pistol and said he'd shoot you if you hurt him too bad. You still don't know if he was joking. The extraction takes minutes if you're lucky. The screaming echoes in your ears for hours. Infection after extraction is common because you don't clean your instruments between patients. The same forceps that pulled a rotten tooth from a miner's mouth this morning will pull a tooth from a rancher's daughter this afternoon. Whatever was living in that miner's abscess is now colonizing the rancher's daughter. But you don't know about bacteria, you don't know about sterilization. You know that some patients heal fine, and some develop fevers and swelling and die from tooth infections that spread to their hearts. You chalk it up to constitution, to luck, to the mysterious workings of the body that no one fully understands. The worst cases come in too late. Jaw infections that have turned to bone rot. Abscesses that have spread so far the whole face is involved. You do what you can, lance the infection, drain the pus, extract what's left of the tooth, but sometimes you're just managing an inevitable death. They came to you for a toothache that they ignored for months because they couldn't afford to take time off work, and now they're dying because a tooth rotted into their bloodstream. A tooth, a single stupid tooth, and there's nothing you can do but make them comfortable and watch. The frontier breaks people's minds. Isolation measured in months between human contact. Brutal winters trapped in one-room cabins with nothing but your thoughts and the howling wind. Trauma stacked on trauma, watching children die, burying wives, surviving violence that would shatter anyone. And when minds break, people end up in your office, and you have absolutely no idea what to do with them. Mental illness isn't medicine you are trained to handle. It's medicine no one is trained to handle, not really. The treatments you've read about are barbaric. Restraints, cold water immersion, bleeding, purging, spinning chairs designed to disorient patients into submission. You don't have most of that equipment anyway. What you have is laudanum to sedate the violent and bromide to calm the agitated, and absolutely nothing to offer the deeply depressed except the hope that spring will come and the darkness will lift with the sun. The diagnosis you use most often is melancholia. It covers everything from sadness to suicidal despair to complete withdrawal from life. Women get it after losing children. Men get it after losing everything else. Their claims, their cattle, their sense of purpose in a land that keeps taking and never gives. You prescribe rest if they can afford to rest. You prescribe change of scene, if there's anywhere else to go. Mostly you prescribe whiskey and laudanum and the passage of time, hoping that whatever's broken inside them will heal the way broken bones heal. Sometimes it doesn't heal. Sometimes the violence turns outward. A man who was quiet last month is now threatening neighbours, hearing voices, convinced that conspiracies are closing in. Your only option is restraint. You help families tie their loved ones to beds, locked in back rooms where they scream and rage and eventually exhaust themselves into silence. There are no asylums within 500 miles. There's just you and families trying to survive their own tragedy. And people trapped in minds that have become prisons. The suicides hit you hardest. The ones you should have seen coming but didn't. The ones who seemed to be getting better before they walked into the desert and never came back. The ones whose families find them in barns, in rivers, at the bottom of mine shafts. Every time you wonder if you could have done something. Every time you know you probably couldn't have, because the frontier offers endless ways to die. And if someone wants to find one, you can't watch them every moment. All you can do is treat the living and mourn the dead and try not to let the darkness catch you too. Cholera arrives without warning and leaves bodies in its wake. One day, everyone's healthy. The next, people are vomiting, suffering violent diarrhea, their skin turning blue as they dehydrate faster than any treatment can help. It spreads through water supplies that everyone shares, through wells and streams contaminated by the very sick seeking relief. By the time you realize what's happening, half the town is infected and you're running from house to house, watching people die in 12 hours flat. Your treatments are useless against cholera. You bleed patients who are already losing fluids they can't afford to lose. You dose them with calomel and make their dying more miserable. You try to get fluids into them, water, broth, anything, but they can't keep anything down. The only thing you can do that helps is keep them as comfortable as possible and prevent the spread, but you don't know how it spreads. You think it's bad air, miasma, something you can't see, so you burn tar for purification while people keep drinking from the same poisoned well. Smallpox is even more terrifying because you can see it coming, the pustules that cover the face and body, the fever that climbs relentlessly, the survivors marked for life with scars that never fade. Quarantine is your only real tool, isolating the sick, burning their bedding, hoping you caught it early enough. You might have access to vaccination, cowpox deliberately introduced to prevent the worst disease, but many people refuse it. They don't trust you. They've heard stories of vaccinations going wrong, of people getting sick from the cure, so they take their chances with the disease and too many of them lose. The mass graves haunt you. During bad epidemics, there's no time for proper funerals. Bodies pile up faster than the living can bury them. You help dig when you can't help heal, shoveling dirt over people you treated yesterday, people whose names you knew, people who were alive and complaining about the weather a week ago. The smell never quite leaves your clothes. The sight never quite leaves your memory. And when the epidemic passes, as they always eventually do, you're left with a town half empty and a reputation for failing to stop something that no one could have stopped. Years later, when you hear about Jon Snow tracing cholera to contaminated water pumps in London, you'll feel sick. Not because it was wrong, but because it was so simple. Clean water. That's all it would have taken. But you didn't know. No one told you. And all those people died while you burned tar and bled the sick and watched the epidemic take everyone it wanted. You might think being the only doctor for 100 miles would make you rich. You'd be wrong. Half your patients can't pay in cash. The other half won't. What you get instead is a frontier economy of barter promises and creative compensation that would confuse any accountant who tried to balance your books. Last week, you were paid in chickens. This week, it's a promise of labour when the patient's broken leg heals. Next week, it might be nothing at all because the family fled their failed homestead in the night. Your fee schedule is theoretical at best. $2 for a consultation, $5 for setting a bone, $10 for surgery, $20 for an amputation. These are the numbers you quote when people ask, and they're almost never the numbers you receive. Miners pay in gold dust, which you have to weigh and hope they're not cheating. Ranchers pay in beef, which you have to eat before it rots or trade for something you actually need. Farmers pay in crops, labour, gratitude, and vague promises that they'll make good when the harvest comes in. The harvest often doesn't come in. You treat people you know can't pay because the alternative is letting them die. And you didn't become a doctor, such as you are, to watch people die when you could help. So you set the bones of families living in tents, deliver babies for women whose husbands gambled away every cent, patch up cowboys who spent their wages on whiskey before they got shot. You tell yourself, you'll collect later. You know you won't. The debts pile up in a ledger you stopped looking at because it only made you angry. The ones who can pay are the ones you like least. The mine owners who want you available on demand but resent every dollar they spend on workers' injuries. The wealthy ranchers who expect house calls at midnight and haggle over your fee in the morning. The saloon keepers who pay promptly but make you treat whatever diseases their working girls have contracted this month, and you'd better not talk about it to anyone. Money in the frontier comes with strings, and those strings usually involve silence, loyalty, or looking the other way when you shouldn't. Some nights you count what you've actually earned against what you've spent on supplies and the numbers don't work. You're barely surviving on the profession that was supposed to make your fortune. The merchants have more cash than you do. The gamblers live better. Even the prostitutes seem to eat more regularly. But you keep practicing because this is what you do now. This is who you are. And maybe next month will be better, or the month after that, or some month that never quite arrives. Here's the cruel joke no one mentions. You're exposed to every disease, every infection, every contagion that passes through the territory, and there's no one to treat you when you get sick. You breathe in tuberculosis from consumptive patients. You touch infected wounds without protection. You sit with cholera victims, smallpox victims, typhoid victims, hoping you won't be next while knowing you probably will be. When the fever hits, you treat yourself with the same remedies that fail your patients. Calomel that poisons your kidneys, laudanum that clouds your mind, whiskey that lets you sleep but doesn't cure anything. You lie in your own bed in your own office, listening to patients knock on the door you can't answer, knowing that your absence might be killing someone, even as your presence might have killed you faster. The chronic problems accumulate. Your hands shake from years of exposure to mercury compounds. Your lungs ache from breathing fumes and dust and sick people's breath. Your back is destroyed from bending over examination tables and operating on patients held at awkward angles. You're 40 years old and feel 70, but there's no one to take over if you retire. There's no pension for frontier doctors. There's just you, working until you can't, and then there's no doctor at all. The drinking gets worse over time. Every doctor you know drinks. It's the only reliable way to sleep after what you see, to steady your hands before what you have to do, to forget the faces of the ones you couldn't save. You tell yourself it's medicinal. You tell yourself you can stop. You tell yourself a lot of things that stop being true somewhere between the first bottle and the 100th. The patients smell it on you. Some trust you less. Some trust you more. At least you understand suffering, they think. They're not wrong. You've thought about quitting, going back east where medicine is more advanced, where you might not be the only doctor for 100 miles, where someone could actually help you if you got sick. But you're in too deep now. The territory is your home. The patients are your responsibility. And if you leave, who's going to treat the gunshot wounds, deliver the babies, pull the teeth, watch the epidemics? Someone has to stay. It might as well be you. So you pour another drink, ignore another symptom, and wait for the next knock on the door. You keep a count in your head that you try not to think about. The dead. The ones you couldn't save. The ones who might have lived if you'd been faster, smarter, better equipped. The count grows every month, and some nights it's all you can see. Faces floating up from memory, accusing you with their stillness of crimes you didn't commit but feel responsible for anyway. The deaths that aren't your fault still feel like your fault. The miner with the crushed chest who was dead before he reached your office. The child with typhoid who was too far gone when the family finally sent for help. The gunfighter who refused to let you operate because he wanted to face his killer standing, and you watched him bleed out in the street. You didn't cause any of these deaths. You couldn't have prevented them. but they become part of you anyway, names and faces that accumulate like snow until you can't remember a time when you weren't carrying them. The deaths that might be your fault are worse. The amputation that got infected, the fever you couldn't break, the medication you dosed too high or too low. You replay these cases obsessively, wondering what you should have done differently, knowing you'll never know if a different choice would have saved them. The uncertainty is its own kind of torture. At least if you knew you'd made a clear mistake, you could learn from it. But frontier medicine doesn't give you clear answers. It just gives you dead patience and endless second-guessing. The families are the hardest part. Standing in front of a widow, a father, a child who was expecting a miracle and got a corpse instead. You learn to deliver bad news with a certain practiced distance, a professional shield that lets you function. But sometimes the shield cracks. Sometimes you see a mother's face crumple and you have to turn away because your own grief is too close to the surface. You're supposed to be the steady one. You're supposed to have answers. But you're just a man who learned medicine from a book, standing in a room that smells like death, trying to explain why God takes and science fails, and hope isn't enough. Some doctors grow callous. You've seen it. Men who stop caring because caring costs too much, who treat patients like problems to solve rather than people to save. Part of you understands the appeal. Part of you is tempted every day to build those walls higher, to stop seeing faces and start seeing symptoms. But you can't quite do it. You still remember every name. And that's either your greatest strength or the thing that will eventually break you. You haven't decided which. After everything, the infections, the amputations, the babies you couldn't save, and the patients who died screaming, you might wonder why anyone would do this job, why you keep doing this job. The answer isn't heroism. It's something smaller and more stubborn than that. It's the moments between disasters, the rare days when the medicine actually works. Sometimes the bullet comes out clean and the wound closes, and the patient walks away a month later to live another 50 years. Sometimes the baby arrives healthy and screaming and the mother survives, and the family looks at you like you performed magic instead of just getting lucky. Sometimes the fever breaks, and the patient opens their eyes and asks for water, and you realize they're going to make it. These moments don't happen often, but when they do, they're enough to balance the scales, at least for a while. You stay because the territory needs you, even if it doesn't always appreciate you. Without you, the gunshot wounds would all be fatal. Without you, the broken bones would heal crooked or not at all. Without you, the mothers in labour would face their odds alone. And those odds are brutal. You're not a great doctor by Eastern standards. You know that. Your training is incomplete, your tools are crude, your medicines are probably poison. But you're here, and being here matters. There's a strange pride in the work too. Not the pride of success, because success is too rare to build an identity around, but the pride of showing up, of being the one who comes when called regardless of what's waiting, of carrying the black bag into whatever horror awaits and doing something, even when something is barely better than nothing. The frontier respects that kind of stubbornness. It respects people who don't quit. And maybe there's something else. Maybe after all the death and failure, there's still a spark of the person you were when you first thought you might become a doctor, back when medicine seemed like a noble calling instead of an endless series of defeats. That spark keeps you going. It makes you try new treatments when the old ones fail. It makes you read the medical journals that reach the territory months late, searching for anything that might save the next patient. It makes you believe, against all evidence, that things might get better, that you might get better, that the future will look at frontier medicine as primitive and be grateful it's past, and something in that progress will trace back to men like you who kept trying in the dark. So how's your career in frontier medicine been? You've soared through bones by candlelight, delivered babies in one-room cabins, pulled teeth without anesthesia, watched epidemics take whole settlements, poisoned patients with mercury you thought was medicine, and buried more people than you've saved. You've been paid in chickens and promises. You've treated wounds with instruments that had never been cleaned. You've stood helpless while children died of fevers you couldn't break and infections you didn't know you caused, still dreaming of being a frontier doctor, of the noble Sawbones with his black bag, riding into town to save lives with skill and courage. The myth is powerful. We've built stories around it. The wise country doctor, the hero who operates under fire, the healer who asks for nothing but gratitude. But the reality was chaos, ignorance, trial and error with human lives as the stakes. Most frontier doctors weren't heroes. They were desperate men trying to help with tools that were already obsolete, in conditions that made modern medicine impossible. The simpler times weren't simpler. They were just more brutal in ways we've learned to forget. Medicine without antibiotics, surgery without anesthesia, epidemics without any understanding of how disease spread. Every treatment was a gamble, and the house always had the edge. Your patients weren't just sick, they were exposed to your ignorance every time you touched them, and many of them died because of things you did that you thought were helping. But here's what makes it bearable looking back. Through all of this, people still practiced medicine. They still showed up at bedsides and tried to help. They still delivered babies and set bones and lanced abscesses. They did the best they could with what they had, which wasn't much, and sometimes, not often, but sometimes, they actually saved someone. They made the difference between life and death with nothing but their hands, their courage, and their refusal to let suffering go unanswered. So tonight, when you visit your doctor in a clean office with sterile instruments and medications that actually work, take a moment to appreciate it. When a surgeon operates on you under anesthesia, with machines monitoring your every heartbeat, remember that none of this was inevitable. It was built on centuries of trial and error, on patients who suffered so future patients wouldn't have to, on doctors who kept practicing even when their practice was mostly failure. The frontier doctors got most things wrong. They were wrong about germs, wrong about treatment, wrong about so much that we look back in horror at what they did to the people they were trying to save. But they were there, they showed up. They carried the black bag into the darkness and tried to bring back the light. And somewhere in the dust of the Wild West, their hands still reach out, scarred, shaking and unwashed, doing what little they could so that someday medicine might learn to do more.